the damage that was created, as in it can't be repaired, and the medication that can actually help with the bladder affects my intestines a lot.
Tabitha, please introduce yourself.
My name is Tabitha Njoroge. I'm 30. I have one kid.
All right, what do you do?
I sell cars for a living.
All right.
Yeah.
And you're an endo warrior?
Yes, I'm
Not yet done with the battle though?
Not yet.
At what point were you diagnosed with endometriosis?
My issue started 10 years ago, but the diagnosis was 7 years ago.
7 years ago?
Yeah.
Before the diagnosis, had you gone to hospital?
Yes, we had, but we hadn't gotten a specific diagnosis on what was going on. At first, it came through like these painful periods. Then I started getting ovarian cysts. So then they said I had PCOS, polycystic ovarian syndrome. But every time after removing the cysts, the pain did not go away. So that's when they did further investigations. And now during one of the surgeries, the first one, that's when they saw the endometriosis.
So you had been treated for ovarian cysts. What else had you been treated for?
Hormonal imbalance. Some doctors were saying it's more of a psychological thing. So I was given antidepressants, basically more or less.
So after that, were you treated after the diagnosis?
Yes, that's when the treatment started. They started on hormonal treatment, more like endometriosis feeds on estrogen. So they try to suppress the estrogen being produced in the body. There's a drug called Lupride, Zoladex. It basically causes a form of pseudomenopause. It tricks your body into thinking you've gone into menopause. But you can't use it more than 6 months at a go. So you have to use stop. Now the problem with endometriosis, the minute you stop, it comes back.
Oh, when you stop that medication, it comes back. So you stopped that medication after 6 months?
Then I started it again. Took it 6 months, stopped, 6 months, stopped, to the point of I had reached my limit of taking that drug, because it also has very bad side effects. Yeah.
Oh. So after you stopped that medication, were you put on something else? And were they treating or managing?
They were managing. And there's no treatment for endometriosis. Yeah, there's no found, as of now, there's no found treatment for endometriosis. So it's all about management.
So they didn't tell you that there is anything that could be removed completely so that you're done with this endometriosis thing?
Different doctors had different views. Some doctors said if I do a hysterectomy, the symptoms will go down. Some said if I remove the ovaries, the symptoms will go down. So all doctors have a different way of treating endometriosis. But at the end of the day, what's important, what was similar was we had to suppress the estrogen being produced in the body.
All right. And all those other suggestions of removing ovaries, hysterectomy, were surgeries. Those are suggestions of surgeries. Yeah. Did you take any surgeries?
Yes, I did, but not to remove the not a hysterectomy at first. As I said, I used to get a lot of ovarian cysts, big, and they used to be very painful. So at the beginning, most of the surgeries were to remove the ovarian cysts. Then, later, as the endometriosis was progressing, it started attaching to body parts. So now the surgeries became more of trying to separate the organs that were sticking together.
So this endometriosis tissue was causing body parts to... Oh, they called endometriomas. They were causing body parts to stick together. So now the surgeries are to separate body
like
parts.
Now, one of the first place endometriosis catches on is your reproductive organs, your uterus, your ovaries. So like now the ovaries would stick to the uterus, and then the tube would stick to the uterus or ovary. That would cause a lot of pain because it's like ovarian tuition, it's like you're being twisted from inside. So the surgeries were to separate that. To the point one of the ovaries and tubes had to be removed because there was too much damage.
There was too much damage.
Yeah.
Oh. You mentioning surgeries. How many surgeries have you had so far?
13.
13 surgeries.
Yeah.
And to what point has endometriosis rose? Because it looks like it rose from the reproductive system and then it went up. To what point has it gone? To what point has it damaged your body?
The last surgery I was done, it had affected my large intestines, stomach lining on the outside, and the abdominal walls.
The abdominal walls are affected, the stomach intestines are affected,
and the diaphragm.
And the diaphragm are affected. Has any of those been removed or cut or anything?
Yeah. During the last few surgeries, during the last 3 surgeries, they had to cut a big part of their large intestines. That was a surgery that was done last year in October. They had to cut a big part of the large intestines, and then I got what is it called? Part of the intestines ruptured during the surgeries. And during the repair, I got into sepsis infection. I had to be put a colostomy, which I had for 3 months.
What was a colostomy?
It's like part of your intestine is brought out of your body to give the other part time to heal. Now you remove your fecal matter using that part that's left outside. So you keep on changing. You're given bags. You keep on changing them.
How long did you stay with the colostomy?
3 months.
For 3 months. That's the intestines. What about the bladder?
No, the bladder has been punctured. Like I think during all the 3 surgeries, my bladder was punctured. And it has caused a lot of issues like infections, cystitis, what is it called? Frequent urination, pain when I'm pressed. So sometimes there's urine retention. I can't even pass urine at all. Yeah, so it has caused quite a lot of problems.
So even up to this point, the damage that was done to your bladder has not been completely repaired.
Yeah.
It's like is there hope that the bladder will get back to normal?
I don't think so.
It's like the damage has already been done.
Yeah, the damage has already been done. And the treatment that will actually help the bladder affects my intestines.
And the intestines also have their damage done. And the diaphragm is also...
No, the diaphragm was fixed. It was put back to the way it was. The damage that is right now is the intestines. They are still stuck together. And so that causes a lot of constipation and irregular bowel syndrome.
So is there hope that the bladder shall be repaired completely?
Not really. The damage that was created, as in it can't be repaired. And the medication that can actually help with the bladder affects my intestines a lot.
And so the intestines, have the intestines been repaired themselves?
They were resected where they had been cut. They were resected, but they're stuck together. They're still stuck together. So I'm stuck with that unless I do another surgery to remove the adhesions, which can't be done immediately because of the timing.
So you've mentioned that you would require another surgery to now separate your intestines. Is that something you're going to do?
Eventually I have to.
So you're still looking forward to another surgery?
Yeah.
Is that the only other surgery you're looking forward to?
No, that's a bit unpredictable because I don't know what, if they go in, I don't know what they'll find. It depends on how it goes basically. I can't predict that one.
So currently, what is your situation currently? Would you say you're cured? Would you say you're managing? Would you say there is still hope that once we do this and this surgery or this medication, I'll be fine?
At the moment, what we're doing is managing. We're managing the pain, we're managing the estrogen levels as we're buying time so that my body can heal, so that you can do the other surgery, not to separate the other organs. If that is done and if it's done the right way, I think it should sort the problem to a big extent. But endometriosis doesn't get cured. There's no I'm waiting for a cure.
You're just waiting to manage better. So you still experience pains.
Yeah.
Do these pains come like now with cycles, or has it become different?
At the moment, the pain is more or less full-time.
Full-time pain?
Yeah.
It doesn't matter whether you're having your period or you're not?
I don't have my periods because I was done a hysterectomy.
Oh yeah, that. So you already had a hysterectomy. You're not even having a period anymore, but you're constantly in pain. Because the endo tissue now is in all these other places.
Yeah, and my body is still producing estrogen.
Oh dear. Now, financially, what has this done to you? Have you been able to take care of all these surgeries? How have you managed?
It has been really hard. But God has helped us in that we never lacked. There's no time that I've gone to hospital and I've not gone to hospital because of finances. Something usually comes up. Our friends come through, our family, supporters. We end up getting supports one way or another.
And who are your support? Who would you say are the people that take care of you? Because I imagine even physically, someone has to be with you all the time.
Mostly like now my mom.
Yeah. She's the one that takes care of you.
Yeah.
Are there times that you need to be rushed to hospital or anything in the middle of the night because of pain?
Yeah.
Oh, okay. Tell me about the recent surgery in January.
Okay. No, in last year, October, I think I'd mentioned I was done a colostomy. The colostomy was to stay for 3 months. That was to give the intestines time to heal. And the reversal was not done in January. But now, during the surgery, the doctor found out that there was a lot of endometriosis in the small intestines. And normally the intestines are in the middle area of your stomach, but because I had been done a hysterectomy, there was a gap left in my abdomen. So my small intestines had fallen down to the pelvic area and had attached themselves to the pelvic bones, pelvic wall, bladder, and then they'd intertwined it themselves. So the doctor had to separate them, and then separate them from the bladder, from the wall, and try as much as possible as to separate as much as he could. But it wasn't an easy surgery. It was a surgery that took 12 hours. And he managed to he succeeded in his part, in that he separated part of the intestines, and not he couldn't separate, he cut and then resected.
Why are you still looking forward to another surgery?
Because one of the pain that I'm in right now, the pain is mostly because of the adhesions that I have. What the doctors couldn't separate, and what occurred after the surgery is what's causing now the pain.
Why do you need another surgery?
Because of the adhesions that were left during that surgery, and the adhesions that formed because of that surgery. Because after every surgery that anyone is done, adhesions form. And because of the multiple surgeries that have been done, there have been multiple adhesions all over my abdomen. So what I need is a specific surgery whereby the doctor is going to separate the organs. It's called anesthesiolisis.
When are you in pain?
Basically full time, unless I'm on painkillers.
So you're always managing pain?
Yeah.
Is there hope that you will get out of this completely?
With the doctor I have right now, he is a very skilled laparoscopic surgeon, and I believe if he can manage to do the surgery he says he can, it will assist a lot with the pain that I have right now. But I can't be sure that I'll ever be 100% free from pain, or what percentage I'll be free of. But at the end of the day, I'm a Christian. I believe in God. I'm a prayerful person, and so I do believe that there will be an end to all this, regardless whether it's through a surgery or I'll just wake up one day with no pain.
What can you tell people out there, or women out there?
There is hope. There is hope. It's hard. It's not an easy thing to go through. Especially, I thank God at least I managed to get a kid. Most of the women I know who have endometriosis suffer infertility. And I can't imagine having to go through what I'm going through and not have a kid. So what I'd say is there is hope. If I manage to conceive with the condition I had, even there's hope. Basically, there's hope. Yeah.